Yes, good afternoon. So, today we are going to talk about meningitis, and specifically, we are going to talk about cryptococcal meningitis. Yes, by name, I'm called Long Bernard Amin, and I work at Lira Regional Referral. So, just to make us understand what is meningitis. So, meningitis is just an inflammation or an infection of the brain and the spinal cord. And one would ask that what are the signs and symptoms of meningitis? So there are quite many. So usually there is fever, there is neck stiffness, there is vomiting, there is headaches, and another question would be that what are the other causes? So the causes of meningitis can be depending on the type of meningitis and what are the types. So first of all, we have bacterial meningitis. Now, bacterial meningitis is a type of meningitis, is an infection and inflammation of the brain and the spinal cord caused by bacterial infection. So when someone has bacterial meningitis, the person has to be put on a long-term treatment, antibiotics treatment to treat the meningitis. And then there is also what we call TB meningitis. When someone has TB meningitis, they are meant to be put on anti-TBs. When they're put on anti-TBs, the infection goes. Now, specifically what we're going to talk about is the cryptococcal meningitis. So the patient that we had in our ward was called Opio John. So Opio John was a referral from Ogur Health Center 3. Opio John is 51-year-old. When he was brought into the unit, he had high-grade fevers, and then he was having neck stiffness, and the family told us that he had been convulsing 2 days before he was referred to Lira Regional Referral here. So he was admitted at Lira Regional Referral here in emergency department on the 12th. When he came in, we tried to, of course, find out his history, and basing on what the family told us, he's a Catholic, he's married, he has 2 children, and he has a wife, of course. The wife told us that his status, that he's a positive patient, that he has been receiving his ART treatment, and that he was diagnosed in 2005, and in all these years he has been taking his medication. However, he has not been following his treatment. He has been off his ART medication for at least 6 months. So when he was brought in, we did a CRAG test, and the CRAG test turned out to be positive. Now, when the CRAG test turned out to be positive, of course, we did samples for liver function test, renal function test, CBCs, and then we took them for analysis. And we also did a lumbar puncture. When we did the lumbar puncture, the pressures were high and they were jetting, and we managed to pick out 20 mils, and the 20 mils were not clear, and we took that as well for analysis. We are waiting for the results. However, we have put him on quite a number of treatment. We, basing on the temperatures which were high, we placed him on IV paracetamol, and since we realized he had infections, we also placed him on IV ceftriaxone, at least 2 grams for 5 days. And since he was also vomiting, we have placed him on vomicaine for at least 2 days, and we have been monitoring him. Now, in terms of the treatments that he has got, I would want to briefly explain on how the treatment plan is meant to be and how usually people with cryptococcal meningitis are treated. But we would also realize that cryptococcal meningitis is usually caused by fungus, Cryptococcus. Usually it's C. neoformans that causes cryptococcal meningitis. Now, with cryptococcal meningitis, when you look at its pathogenesis, you realize that usually in the first stage there is inhalation, whereby someone breathes in the fungus and it goes straight to the lungs. Now, usually when that happens, you realize that this fungus lives in soil, and so it usually comes from the droppings of the birds that then ends up in the soil, and then someone inhales it. Now, when someone, as we are inhaling and exhaling, you realize that someone breathes in the tiny spores of this fungus, and that usually escapes and then it goes straight up to the blood. So when that happens, this fungus usually gets to cross the blood-brain barrier, and when it crosses the blood-brain barrier, we get to realize that this infection spreads straight up to the brain. Now, when that happens, usually people who are immunosuppressed, like for instance, people who have HIVs, you realize that because of their low immunities, the disease gets to overpower them, and in turn it gets to cross the brain, just as we have said, and then usually there ends up to be damage in the brain. Now, with people who have meningitis, usually when you do the tapping, because it's a sterile procedure. Since it's a sterile procedure, that means everything you are going to use for removing the cerebrospinal fluid has to be sterile. It has to be the sterile gloves, it has to be the sterile syringes, even the gauze that you're using. Of course, you have to use lignocaine to make sure that the patient doesn't feel pain. Now, as you insert and wait to see the color of the cerebrospinal fluid, one, usually in this case, because it's mostly in bacterial meningitis, sometimes the cerebrospinal fluids are pus in nature, but in this case it is not usually pus in nature. So our patient, just as I told you, we managed to withdraw 20 mils, and the cerebrospinal fluid was not clear. And I also said that the pressures were high and jetting. So that means that the infection in the brain, that means that the infection in this case is too much, because the pressures are high and they are jetting. That means the infection has clearly crossed straight into the brain. Now, when you're treating such a person, because just as we have said, the cryptococcus has crossed and has entered into the cerebrospinal fluid. So when we even did the CSF, we realized that it was also positive. The CSF crab was also positive. Now, when you're doing the treatment in this case, the treatment